Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And this patient has fully occluding wax extending from the entrance all the way to the eardrum. It's quite a dense consistency of wax, so I've just installed some medical grade olive oil, trying to break it, loosen it down a little bit. And as you can see, it's up against the canal wall, so hopefully the oil can help me to separate this wax against the canal walls. We're just past the first bend. We know that because we can see the hairs on the left hand side of the cartilage protruding outwards. So that's the first bend you can see just on the left of screen. And that's where you get the majority of the hairs. These hairs are found in the outer third, the cartilaginous portion, but near the entrance of the ear canal, these hairs are protruding outwards, and they're protruding outwards as a defensive mechanism. It's trying to prevent foreign bodies, particles, insects even from entering their ears, almost like barbed wire. And they're normally more prevalent on the posterior, so the back part of the ear canal. As we delve deeper into the ear, the hairs become more flattened against the canal walls. And of course, the inner 2/3, the bony part, you shouldn't have any hairs unless they're loose hairs or matted hairs. And you can see there's a layer of thick skin enveloping this wax plug, so I'm just separating it. Now, most of our ear canals are oval shaped, the height is greater than the width, and this patient's ear canal was no different, but there was less of a difference between the height and the width, so it's more kind of cylindrical, it's more circular, rounded than the usual ear. Again, I'm just getting this skin in focus. You can just see that clarity that we can see with the skin. Anyone watching this on LinkedIn, I do upload this on LinkedIn for my professional colleagues as well. The LinkedIn video quality upload is not always great, so if you are watching on LinkedIn, feel free to switch over to YouTube, Facebook, Instagram or TikTok. So you've got a lot of choices there. But yeah, unfortunately, LinkedIn upload quality is not the greatest. And if you are a clinical ear care specialist, or someone suitable to being trained to perform earwax removal, so whether that be an audiologist, a medically qualified doctor with experience with examining the ears, a nurse with at least 12 months experience with ENT or otoscopy, same for a paramedic, or a hearing care assistant who's been qualified for 2 years, feel free to get in contact with us, info@clearwax.co.uk. And we can give you more information about our training and about the device itself. So I just went to the roof of the ear canal there to separate some of this dead skin. I'm going back to the floor. I think I might just use some more oil. Let's just see. Yes, we have. So this wax is probably about halfway in the ear canal. Because of the magnification, it appears right to us, and which is one of the benefits of the WAXscope, the magnification it provides, especially in comparison to other methods of visualization like head loupes, which provide significantly less magnification. I'm just trying to go all the way around the edge. And when you've got great magnification like this, it can really allow you to work closely to the eardrum or to the canal wall. I'm just trying to give it a little wriggle. So I'm using the medium-sized specular here, which you can just see around the edge. And then we've got a smaller size and 2 larger sizes as well. So I'm just dilating this patient's ear canal open. I'm just going to get focused to the top part. And I'm going to try and peel this downwards because it is stuck to the top. I can feel that resistance when performing the procedure. There's a thick layer of skin here that's adhered itself to the roof. And so we're just trying to loosen that part. Although it's not Courtesis obtransit, it had that kind of the texture of this wax, the density, how impacted it was. Because Courtesis obtransit is dead skin. It's a epidermal plug. Here is actually a lot of its wax, but it had similar characteristics, and I've just managed to glide the correct superiorly. I'm just removing a bit. Now, although the wax plug didn't come away, even removing a segment like this is now going to make the rest of the procedure a bit easier. So we cleared quite a sizable chunk, and that last bit of wax in the distance, that's right up against the drum. We've got this slither at the front part of the ear canal, so let's peel this away. Again, we can work so close to the canal wall with confidence because we've got a good view, good magnification. Again, I'm just going to kind of enter and go upwards. Again, I can just see a bit of wax there. It's the front part of the ear canal. You can see what I mean about this circular shape of the ear canal. So it's, as opposed to being a distinct oval or an egg shape, it's more like a football or soccer ball. Again, I'm just bringing this down just to release it. So this part of the wax plug is larger than the section directly in front, so I'm going to have to wriggle this through. And it's very dark, you know this has been there for a while. You can tell by the colour it's oxidised. Again, I'm just focusing on that roof at the moment. Again, I'm just entering, I'm rotating the wax go upwards so I can see more the top part of the ear. And now I've got a good suction grip and we're going to bring this away. And I've got a still image of all the wax if you stay to the end. So it's going to visualize the eardrum. So you can see there, you can see the hammer bone. They've got quite a deeper in the ear. There's a prominent valley at the floor of the ear canal, which made it a bit more tricky to remove. But that's all the wax. I hope you enjoyed that video, guys. And again, if you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you. Bye.